This one color. Can everyone see?
Yes, yes.
Okay, Bismillahirrahmanirrahim. Saya Dayana. Saya speech and language therapist dari Sparkle Therapy Center. Saya dapat my certification dari UK, University of Reading. I did my master's integrated in speech and language therapy. Now I'm working with Mila. Okay, hari ini we're doing learning disability. Ini yang banyak dipilih oleh kawan-kawan yang ingin mau tahu, ingin mau belajar bersama-sama. Okay, today topik kita understanding learning disability. Okay, Bismillahirrahmanirrahim. So ini session outline.
Mbak, kecil Mbak, aku zoom Mbak.
Mereka Kak Beb, okay, wait, okay. So hari ini kita akan talk about causes, signs and symptoms, assessment dan intervention. So dalam presentation ini saya akan buat dalam bahasa Inggeris dan bahasa Melayu juga. Indonesian sikit sahaja, tapi sila berikan komen atau angkat tangan saja jika mau lebih explanation, okay? So, apa itu learning disability? Learning disability is used to describe the brain's difficulty dalam memprocessing information causing specific kinds of learning problems due to neurological difference. Okay, saya buat di sini kesukaran pembelajaran disebabkan oleh kesulitan neurologi yang mempengaruhi cara belajar seseorang individu. Okay, it's the brain's issue in having difficulties with processing information. So with these kind of children, they may take longer time to learn, longer time to use the knowledge, and even need further support with what they've been taught. Okay?
Melayu. Change that to Melayu.
Okay, so kanak-kanak ini yang belajar, mereka akan mengalami kesukaran dalam pembelajaran lebih daripada yang biasalah. Sebagai contoh, diorang menggunakan lebih masa atau menggunakan pertolongan dari cikgu atau assistant lah, teaching assistant. Okay, so they will find this challenging. Memang susah untuk mereka oleh sebab neurological brain dia. Okay, so for these children, there's approximately around, I have an average number, about 4 million children and teenagers, young adults who have learning disability, okay? And they have different ways of coping and learning how to support themselves, okay? Different people, different ways of learning disability. Okay. So, as I said before, they will face issues in learning and using certain skills. Sorry, they will have trouble in reading, writing, spelling, so literacy. So these are common skills that you need when you're in school, especially with learning as well. For example, in maths, they will find it difficult to do mathematics and sometimes having understanding of social skills. So, mereka akan mengalami kesulitan pelajaran dalam hal memahami, menulis, memproses, dan mengingati informasi yang diberikan. Okay. So, for example, as I've said before, it will have to do with their coordination when it comes to reading, writing, and attention as well. So, for example, this is one of the things that they will struggle with, language processing, phonological processing, so the sounds that you hear, visual spatial processing, so that is to do with organization, and the rest is there, so memory and attention, okay? Let me do this one. And then this will affect their oral language, so listening, speaking, understanding, their reading, their mathematics, as I said before, the orang punya organization, okay? So learning disability is an umbrella term, so everything is under here. It's a lot of difficulties, a lot of terminologies under one term.
Ah,
Okay.
nama learning disability ini nama diagnosis yang menyeluruh. Okay. Yang meliputi semua banyak-banyak perkara. Ia bukan satu perkara sahaja. So it's like a lot, banyak.
It's a long list. This is a well comprehended one that I found online, but we will get more into it in a bit. Okay. Okay. So here are some facts that I will share with you. So learning disability is different from intelligence level, okay? Orang yang ada learning disability tidak sama dengan, tidak semestinya mereka ada IQ yang rendah juga. Okay, most of the people yang ada learning disability, they have average or even above average IQ level. So it's not related or it's not the same as intellectual difficulties. That is another topic, which I'm sure Sparkle will be more than happy to take over next time. But so that's just a common misunderstanding when it comes to learning disabilities. Okay, next one. It varies. Okay. Learning disability kan dia banyak. So seorang individu boleh ada satu learning disability, another person boleh ada macam-macam disability. So it's berbeza dengan masing-masing lah. Okay. And then impactnya juga itu yang penting untuk kami tahu dari segi social, emotional, dan academic di sekolah. Okay. So for example, if someone has difficulties with reading, they feel like, oh, they don't want to read anymore. So that stops them from possibly going to school, stops them from seeing their friends. So that affects that emotional aspect as well as academic. Okay. And what's interesting about learning disability is it's very hard to diagnose or even acknowledge that, oh, this person may have learning disability. It doesn't stay with you when you're just a child. It is a lifelong condition. It's a chronic condition. So this will be until they are from birth till passing lah. Okay. And some people may not even be diagnosed because it's very tricky. It's very difficult. It's for those that are have that awareness, they can get diagnosed until they're later in life compared to when they were younger. Okay, which is quite a missed opportunity lah, because you can have the chance to get the support when you're younger, but that doesn't mean it's too late. You can still get the support when you're older. Okay. Mila, did you want to add anything?
No, you added.
Okay. All right. So, signs of learning disability: poor literacy skills, mathematical deficits, dan social skills. Okay. Mau translate? Okay, teruskan. Saya ada bagi examples juga. Literacy skills bermaksud reading, writing, spelling, understanding. Okay. So this is more focused on children, okay? So they will find it hard to learn new words they hear in school or in conversation. Troubles with reading and understanding, they take longer time to read a single word or a single passage. You can see that they're struggling to even understand what they just read. They can read, but that doesn't mean they understand. So that's two different skills. Alphabets pun mereka rasa sangat susah. For example, alphabets for us easy. A, B, C, D. Bagi mereka A, J, Z. So it's the campur, it's mixed. Numbers juga. Numbers for us, we are able to remember the numbers, we can organize it, and we can sequence it and say it correctly. For people with learning disabilities, if they struggle with numbers, they don't even start with the number 1. They start 5, 7, 5. So it's a jumble of all that information in their head because their brain is finding it difficult to process that information. Okay. So reduced memory skills, they find it difficult to remember the information. They find it hard to even try to remember what they just learned. So their memory is not the strongest skill. Not understanding questions or instructions. So for this one, if someone asks you a question, you listen, you hear the keywords, you know what you want to answer and what they're asking, and then you say. For people with learning disability, as I said, it's the processing kan. So the processing, there will be gaps, and therefore they don't have the final product, which means they don't understand the question, or if they hear the question, they don't answer it correctly, or if they're given instructions, they only hear certain parts, or they don't even do it correctly at all. Okay, so they will find that difficult. And difficulty in writing and spelling. So for example, there will be more examples later. So you can tell for children with learning disabilities, you can tell from their handwriting, because what we see in alphabets in our heads is different compared to what is written. Well, at least for these people lah. Okay, so there will be you can see that they will have troubles, as in they will have a lot of errors, and it's quite distinct from children that are they don't have learning disability. Okay. Mathematics. So this one is everything to do with numbers and maths. So they find it difficult to understand symbols. So like plus and minus, for example, 1 plus 1 is 2. But for them, they don't know what plus is, or they misunderstand that plus means divide. So it's things like that. So the function of the numbers, they find it hard. Okay. Struggles in memorizing timetables. Again, this is to do with memory. This is to do with understanding, oh, timetable works like this. 1 times 2, 3 times 4, like that. But they don't understand that, therefore they cannot process it, and they don't memorize it. They find it hard to memorize. Telling the time. So for us, we can tell the time easily. If we look at numbers, or if you look at my clock on my wall, I'm sure you'll be able to tell. But for them, it's all mixed up. Okay, they don't have that skill, or their skill is not that great to say it immediately or even say it correctly. Okay, not able to solve simple maths. Yes, as I said before, simple maths as simple as 2 plus 3, they require time to do it. Okay. The things that I say here, they don't necessarily mean that they cannot do it ever. It just means that they take longer time. Okay. And they need the support. With support, they can do. Okay. So troubles with counting money. Again, money is to do with numbers. So you have tens, hundreds, dollars. Okay. Currency is another thing. So that's a different way of using numbers. And as I said before earlier, they have issues with remembering phone numbers or sequences. So saying the numbers in order, 1, 2, 3 becomes 5, 9, 13, 14. Or phone number as simple as 911 can become 119 or 118. So it's all mixed up. And then social skills. So because they have troubles with processing, this is our niche. We understand that for you to say what you want to say, your brain does all the work for you. But for them, their brain works quite differently. So they don't process the same as us. Therefore, they struggle. They find it very susah to express their own thoughts. They have low confidence because they know what they will say people don't understand, or they feel like they're being misunderstood all the time. So they're no longer interested, or their confidence is already out the window. Okay. Reluctant to ask for help or support. This one is quite true, but it's quite sad because they see it as they see themselves as failure, whereas there's so many options that they can have. They can reach for support, but it's always hard for them. And it's also about understanding that, oh, you can still do it, but with support. But for them, it's already, oh, I cannot do it, therefore I cannot do it ever. Okay. Difficulty in recalling event. If you want to talk to your friend, you talk about the past, the present, the future. Okay, so people with learning disabilities may, as I said before, they don't have the strongest memory. So being able to keep up with what's happening in conversation will be very hard for them. Yes, so this can cause emotional feelings of stress, anxiety, frustration, and avoidance behavior. Okay, avoiding things purposely because they know that they won't excel. Okay, now we go into specific learning disabilities. So, learning disability was the general term. Specific learning disability refers to one specific learning disability. Okay, so I will share the examples.
Specific learning disability maksudnya satu. Dia tidak menyeluruh. Dia only refer to satu jenis sahaja. So that's what we call specific learning disability. Yeah.
Thank you, Mila. So this one we have dyslexia. Dyslexia refers to people who have difficulty reading and spelling. So they will find dorang akan kesukaran dengan belajar membaca dengan lancar dan dengan kefahaman yang tepat. So for example, these are the things that people with dyslexia see, okay? Different individuals, different types of visual dyslexia. So sometimes the words are mixed up, so we have the seesaw effect, and sometimes the words are shaking. What they see, the words are shaking, and this can give them headache. So again, they get headaches, and they get stressed, they get frustrated, they don't want to do it, avoidant behavior. So it's a lot of things on top of each other, okay? So this one, dyslexia, difficulty in reading and spelling. Next one, we have dysgraphia, difficulty in writing, so penulisan, control, fine motor skills. They will find it hard to write properly, to write neatly, write in a straight line, okay? Kesukaran dengan menulis secara betul dan teratur. So sebagai contoh, menulis huruf secara salah. For example, B becomes D atau E becomes terbalik. Okay, campuran huruf besar dan kecil. So capital letters and low letters, okay? And then this one, this is the example I have for you. So this is it's from a individual with learning disability, specifically dysgraphia, difficulty writing. Does anybody want to guess, mau teka berapa umur individu ini? Boleh lihat dulu, boleh tengok. Tidak payah umur lah, age group. So dia kanak-kanak atau orang muda atau orang tua.
Boleh tulis dalam chat also, no problem. So I'm guessing a bigger child.
Okay, we have bigger child. I think some of the chats are coming through. Nila, can you help bacakan?
So we've got people saying orang muda, so teenager maybe. Someone said 12. Someone said 8.
Oh.
Two people said 8. Yeah.
Okay, so this is the handwriting of an adult, a fully grown adult. Dia orang dewasa, umurnya 40-an tahun. Okay, so nampak, you can see the letters from the first row tidak sama dengan letters in the second row. And you can see each time it's different. The spacing is different, the letters are different, the alignment is also not consistent. Okay. So that was dysgraphia, kesukaran dengan menulis. Next we have dyscalculia. So dyscalculia, yeah, so difficulty with maths and numeracy. Okay. So they find it hard to understand arithmetics, mengerti aritmatika, memproses satu angka susah, mengubah angka pun susah. Okay, counting 1, 2, 3 berhitung, they cannot do it. Okay, they take time to do it. So this is what we see on the left. We have our numbers, straightforward, simple, able to answer. On the right, we can see that it's all mixed up. It's all jumbled. The numbers are not the same. The symbols are also everywhere. So this is what visually, it doesn't have the same representation as the one with dyslexia, but this is what you can expect to assume lah for kids with learning disability, specific learning disability. Okay, so let's recap. We had dyslexia, difficulty reading, dysgraphia, difficulty writing, and dyscalculia, difficulty with maths specifically. Okay, maths is numbers. And this is an interesting example. So this is what we mean when we say their brain processes differently. That is a very specific topic that I will not get into because it's all to do with neurology. And so the gist of it is that people with learning disabilities, their brains don't function the same way as people without learning disability. So meaning their brain activation is not the same. For example, they might underperform. So for this one, dyscalculia, this is the brain that is responsible for numbers, for us to understand numbers, for us to be able to see and solve arithmetic problems. But for them, this one is not as active. Therefore, they don't perform as well. Okay. Dyslexia, for example, so this is different parts of the brain, okay? Our brain is responsible for the many things that we do, the many things that we see, we hear, we learn, okay? So for example, dyslexia is a different part of the brain. Instead of up here, it's down here. Under activation, meaning it's not as active as it's supposed to. It's not working as hard. Therefore, it's not processing as much as an average person, okay? As a person without learning disability. Okay. So how does it happen? As we said before, we heavily emphasize that it's a neurological disorder affecting the brain to receive, process, store, and respond to information. For example, we see kucing. Kucing, kita boleh tengok, kita boleh melihat benda itu kucing. So we receive the information and then we process or we think, oh, ini bahagian binatang. Binatang yang mana? Yang ada kucing, yang ada kaki, yang ada mata, ada paws. Oh, dia kucing. Store, kami boleh mengingati. Kami boleh tahu, kucing ini bukan buaya. Dia bukan dalam air. Okay, we have those previous information. And we respond. We respond by saying, that is a cat. We acknowledge it. Okay, so that's an example. But for people with learning disabilities, they might even find it hard to receive the information. So that's already the first step. Okay, or even processing that information. So there will be gaps in between the process of the brain. Okay, so this is, again, it's a summary. Difficulty understanding or following instructions, poor reading or writing skills, finds math challenging, difficulties organizing thoughts or tasks, and remembering information. So why does it happen? So there has been a lot of research, but it's still something that is an ongoing search. They do not know all the possible causes of learning disabilities, but they have identified risk factors for developing a learning disability. Okay, so for example, neurological affected brain development. So this can happen due to traumatic brain injury. For example, if you got into an accident or no, sorry, let me rephrase that. Okay, so for example, there are neurological risk factors. So yes, brain injury or small brain development since birth or how the brain is structured. Okay.
Neurological is masalah saraf ya.
Okay, So for example, people with dyslexia, difficulty reading, so that is concerning a certain part of the brain. So for example, people with dyslexia, that part of the brain is small. For example, it's smaller. Okay, so therefore they don't have that part of the brain that can help processing. Okay. Okay. So genetics as well, inheritance. They found that families who have a history of learning disability have a likelihood of inheriting that trait. So it is from previous families, like individuals. Okay. And then there's also, when it comes to reading disability specifically, fraternal identical twins are likelier to have difficulties compared to identical twins. Okay. Let me just check. And then environmental factors. So this is to do with mom carrying the baby. So prenatal can be, this is complications during birth. So it's very important that we take birth history so we know what can explain the outcomes of the learning disability.
So we can
Okay.
predict too, memikirkan apa possibility yang menyebabkan masalah learning difficulty.
Yeah. Okay. So for example, before giving birth, the mom may be exposed to harmful substances like drinking or smoking or drug abuse. Okay, so that obviously directly affects the child because it's in the blood in the blood of the mother. The blood goes through the child, and therefore it's all manifested in the child lah. Okay. And especially in premature babies, if babies are born earlier than expected, they're subsequently at risk of developing learning disability. Perinatal complications during birth, possibly the umbilical cord is tied around the baby, so that when that happens, the baby has less oxygen, and therefore oxygen is not being sent to the brain. The brain needs oxygen for it to be developed. And because of that, less oxygen, less brain development. Okay. And then postnatal, when the baby is born, if they have meningitis, okay, or for example, if the baby is exposed to harmful substances, like I think it was paint, lead-based paint, that is known to cause brain injury. So that is one of them. Okay, and then cultural and economical. We take into consideration that not everyone can afford healthy food or have enough nutrition to grow healthily. So poor nutrition is one of them, and as well as adverse childhood experiences lah. Okay.
You can Melayukan that one?
Would you mind doing this for me?
So kalau cultural and economical, so selalunya orang yang datangnya daripada background yang kurang ya, yang nggak punya banyak wang. So most of the time jenis makan yang mereka makan tidak banyak, tidak pelbagai ya. So
Tidak bergizi ya, Kak.
ya, so gizi makanannya itu tidak cukup untuk perkembangan otak. So one of the main things that kita perlu fikirkan, especially in sekolah, is permakanan kanak-kanak. Anak itu permakanannya, adakah sempurna, cukup, adakah ia pelbagai. That's why dulu-dulu di Eropah ada perkembangan movement into minum susu. Semua orang mesti minum susu. Okay? Because they found out kebanyakannya anak tidak minum susu. Tapi ada juga macam in Brunei, kerajaan Brunei, kita punya sistem where makan anak dijaga. So ada bantuan makan di sekolah gitu. So every kerajaan ada different types of bantuan that they can offer untuk membantu. So being poor, so kalau kita tidak cukup untuk memelihara anak, that actually is part of the impact lah. So anak yang tidak cukup, tidak berkembang, dan therefore highly likely, mungkin kebesar mungkinan, ya, bukan semestinya akan sebesar mungkin.
Iya Kak, siap.
Thank you, Mila. Okay, and then I will share with you some numbers, statistics on learning disability. Right now, the numbers that I have is based on countries that are not in Asia. Okay, the statistics there is not quite either updated or it's not fully relevant to our to our population. Okay, so we only have UK for now. So as of 2020, 1.1 million adults have learning disability. 353,000 children have learning disability. Children from poorer families are more likely to have LD, as said before. And 200,000 children recognized to have learning disability are receiving special needs support in school. Okay, so this is just a gist on the numbers that, learning disability is quite common, and it's a lot. Okay, we have on the US as well. So for this one out of 5 children have some degree of learning disability. Again, learning disability can vary. It can vary from just one disorder, or that's one specific disorder, or if it's more general, just difficulty. Okay. It's more likely to occur in males than females in US setting. 4 million children younger than 18 in the US have learning disability. And ADHD, dyslexia, and dysgraphia are most common as specific learning disability. Okay, I've not gotten into ADHD, but this is more on the general ones lah I'm getting into. Okay, ADHD is to do with attention deficit hyperactivity disorder. Okay. So who can help? Supporting individuals with learning disability, it's not necessarily, well, most of the time, it's not just one person, it's a whole team. It's the child, and then we go outside. Who's the immediate people in the child's life? The family. So we have the family. And then professionally as well, we can have clinical psychologists. They do assessment. They can see how much this child can do, what else this child needs help with. They also support with behavior and provide compensatory strategies. So strategies to support with their learning. Okay. That's clinical psychologists. There's us too, speech and language therapists. We help with communication needs. For example, as we've said before, these people have difficulties in expressing what they want, or they need help with social skills. And we also are able to train parents. We also work with parents to give that support, not just in therapy, but at home. Okay, we also work with teachers too. So that's our role. Occupational therapist, this one can help with accessibility of environment. For example, in school, some children need specific resources to help them in school. I believe, for example, children with dyslexia, they have specific types of reading materials lah. It's not the same, but it's part of the learning experience too. We don't want to seclude the children too much from what the other kids are learning, because then they will find it difficult or feel that they are different. But we want to encourage them to do more, to do it correctly, to do it better than doing nothing. Okay. So occupational therapists can also assess and support life skills. Okay. And special education teacher. So SEN, special education needs teacher. This is more of in school setting. So providing one-to-one support in school. For example, if the teacher is teaching and then the child is there and another teacher is right next to the child to learn, to teach and aid him along the way. Okay, monitor progress and prepare the child for their specific needs. Okay, there's more usually, for example, educational psychologists, for example, in exams, they will need those kind of arrangements. Doctors can also help, they will keep track of the child. But yes, this is the general one lah. Okay,
Emotional support as well for doctors, medication when required, because it can get overwhelming. They tend to be kemurungan, so that's where doctors will be able to help with medication. So a lot at different ages, at different stages.
okay. So now that we've learned a bit about learning disability, we will go into myth versus reality. Myth meaning that it's the things that people believe, but it's actually not true. Okay, so myth versus reality.
Dongeng.
How else do you want to?
Myth is dongeng, right? Like macam bukan nyata, tapi
Ya,
selalu dipercayai.
mitos di kita, Kak.
Betul, betul. Mitos. Yeah.
Okay. Let's hope my presentation works. Okay. I have a few examples I will share with you. You can comment or you can turn on your mic to share which one you think is right. Okay.
So untuk ini, I think we go to the chat. So
Sabar.
Ya,
we'll,
bisa di chat dipilih gitu ya, Kak.
and then we go to the chat, everybody answer which one is it, myth or reality, then Dayana will share the answer.
Okay.
Oke.
We're all learning together. No right or wrong answers for now. Okay. This is our way of learning. Okay. Example 1. People with learning disability are not very smart and have low IQ. What do you think? It's quite common for these people to be called lazy.
So we have Pebi saying it's a myth, and Anita saying it's a myth. We also have Indah saying myth, Dini saying myth. Yeah. Anyone else wants to try? Keep typing your answers. Let's see if ada more response. Rizky saying myth. Nanda, myth. Ervina, myth. Go on, Dayana.
Everyone is correct. It is a myth. As we have discussed before, they have, not everyone lah, but most of them have average or above average IQ. As we've said, IQ is not related to learning disability, and it's not that they're not very smart. People with learning disability, you can see they're trying very hard. They're doing extra class, they're doing additional support. And sometimes once they put in a situation where they did their exams and the outcome, unfortunately, is poor or they're underperforming and they still get called lazy. So it's not the correct term to use. And we emphasize on how hard they are trying and we give them support where it fits best. Okay, next example, LD can be easily diagnosed.
Put your answers in the chat.
Easily identified and diagnosed.
Mudah. Learning difficulty mudah. Kita mudah diagnose. Kita boleh nampak dengan mudah. Is that a myth, mitos, ataupun yang sebenarnya? We haven't had an answer yet. Sharon. So
Take
is
your
there myth?
time.
So that's Ellen, right? Ellen said myth, Anita said myth, Baby said myth, Ervina said myth. Okay. Nandana said myth. Well done.
Well done. So the answer is, it is a myth. So we, just to recap earlier in the presentation, that it's a lifelong condition and it's very difficult to be diagnosed. People can find out as early as 3 years old, and people can find out as late as once they start working already. They face a different kind of struggle. And diagnosing late is just as important as diagnosing early, because then you have a sense of understanding as to how your brain works, and you can try the things that you've not tried before, or you acknowledge that, oh, you've tried hard, but that doesn't mean that you're not smart. It means that you just need more support. Okay? Good answers. Next one, we have LD is a long-term chronic problem and is only affected in children.
Let's go. Go to the chat and give me your answers. Anita said myth. Baby said myth. Saida said myth. Ellen said myth. Indah also said myth. Well done. We're
Okay.
doing very well today. Go on.
Oh,
Ervina said
that is a myth, because even though this fact is correct, it's a long-term problem, long-term chronic problem. It's not only affected in children, it's affecting all life, ages of life, okay? As said here before. I was trying to trick you, make sure you're awake. Okay. LD can be identified in all ages of life. So these examples are quite overlapping.
that's fine. Answers in chat. Anita said reality. Feby said reality. Ellen said reality. Indah also said reality.
Okay.
Smart Orica Batam, hello. Also said reality. Juliana said reality. Good.
Well done. Good listening, guys. It is a reality. Okay. Yeah.
It is.
It's long term. It will be with you. And you can get it diagnosed no matter the age. Okay. Well, better not when you're born, but of course. Yeah. Okay. I have a few more. Okay. So LD affects more than academic outcome and performance.
Answers in chat. Anita said reality. Feby said reality. Sharon Ellen said reality. Indah said reality. Saida said reality. Juliana said reality.
Good. It is reality. I think we've had a talk earlier that it's not just about academic, it's the social outcome as well. And as well as your confidence. Okay, so that's your self-advocacy. LD is a result of lack from parental support and neglect. So LD disebabkan oleh ibu bapa tidak peduli anak, membantu anak.
Anita said myth. Feby said myth. Smart Orica Batam said myth. Ervina said myth. Come on, guys. You can do this.
No right or wrong answer. Everyone's learning. Well, there
Good
is.
job, Juliana. Juliana said myth. Dini said myth.
Okay. And everyone is correct. It's a myth. Okay. Again, one of the key points of LD is it's a neurological problem, and the cultural and economical factors, those are only risk factors. Okay. It's different. Learning disability cannot be cured.
What cure? What the meaning cure, Kak?
Tidak boleh diperbaiki, tidak ada obat.
Oh, tidak bisa diobati.
Oh, ribet.
Eh,
Go on, people, go
tidak
on.
bisa diobati, tapi bisa membaik. Berarti apa ya?
Don't think out loud. Come on, people. Go in the chat. Give your answers. That's a hard one. So we have Anita that says myth. Everyone else? Feby said myth.
Yeah, we can help.
What's
We can help.
Okay. This one is tricky. Ya.
Tricky.
Banyak yang tidak mau menjawab ya. Enggak apa, jawab saja. Lurus, betul, tidak betul, that's something else. Saida said, nanti question mark. So she's also
If tell about neuro is cannot ya because it's nerve.
Dini said reality. Okay. Indah said reality. Good try. Good trying. Go on, Dayana.
So I wrote reality. It's as we said before, this example is saying that it cannot be cured. Cured is on the medical aspect. It's something that you can fix and then it won't ever happen again. It will get better. But that's not the point of learning disability. Learning disability is in the brain, kan? So it's about the processing. It's not like an injury on the outside or on the inside that can be fixed from surgery, that can be cured from surgery. But there are strategies, there are support, there are things that can help the child to do better. Okay?
It's more of wordplay rather than anything.
It's tricky. But good try, everybody. Well done. Okay. Last one. All learning disability individuals are the same.
Okay, let's go. Dini, very good. Dini said myth. Ervina said myth. Smart Orika Bata myth. Anita said myth. Ellen said myth. Baby said myth. I miss you with the last question, Helen. Ina said myth. Okay. And we had Tio just now who answered, now not answering.
And everyone is again correct. That's right. Every individuals are different. Some individuals with LD are severe. For example, they have all the 3 specific learning disability, whereas some people they just have difficulties with reading but can do other things. Okay. So keep that in mind. Remember that everyone will perform differently, but it's the same basis lah. Difficulties with processing information in the brain. Okay. So our role, speech and language therapy approach, I'll just breeze through this quickly. We can provide support for people with learning disability. So we do consultation first, we talk with the parents, we do case history. And then we also take information from the school, so reports, teachers' feedbacks, because this is more not easily, it's more identifiable in school setting because it's more about literacy, it's about mathematics, social skills as well. How is the child doing with making friends, being able to communicate with teachers? So we look into that.
So can I interrupt and just say, learning disability usually can be diagnosed above 5. Kalau di Brunei, mandatory schooling is 5 tahun, ya. Kalau di Indonesia, umurnya berapa mandatory? Harus di sekolah, umur berapa?
Sekolah SD kan?
Ya, ya.
Atau TK?
Not daycare. 7. Ellen said 7.
Ya, kalau di SD 7.
So when you are in mandatory schooling, that's when you start to learn literacy. So that's when you will start to see kalau anak itu punya learning disability. Because most of the time when you are at home, not every family will work on literacy at home. So that's why this one, we say in Brunei, starts at 5. Australia, UK also starts at 5. But maybe in Indonesia starts at 7 because that's when children start to go to school. Yeah.
Actually, in Indonesia, we have like kindergarten like that. So we can start since 3 or 4 years, Kak.
But it's not mandatory. Tidak semua.
No. Yeah, no.
So you cannot buat kenyataan secara menyeluruh sebabnya tidak semua anak masuk ke sekolah pada umur 3 ke 4 tahun.
Betul.
So yang important is you pakai dasar kerajaan. Kerajaannya bilang 7 tahun, therefore we start diagnosis pada umur 7 tahun. Di Indonesia. Yeah.
Yeah. Okay. So even if the child belum lagi sekolah, sometimes parents antar anak dia ke daycare. So sometimes we get reports from there also. Okay. So assessment, for us to confirm the diagnosis, we do different kinds of tools. So we note their social skills, we look at their understanding. We have different kinds of assessment materials to address the needs lah. Okay. And if we can see that the outcome is quite poor, then that will help towards diagnosing learning disability. Okay. So we look into their understanding and verbal expression, ability to talk about their needs, talk about using grammar correctly. So it's the little things that matter. Okay. And then we look at intervention. Intervention meaning we start therapy. So we do, well, at Sparkle, at least we do play-based approach. We attend weekly therapy, and we also tailor it to the child. So it's different for each individual. Everyone excels differently. Everyone has different strengths and needs. So we make it to the best of the child's ability. And at the same time, we continue it at home, because kids will be able to learn that, oh, it's not just at Sparkle, it's at home too. So parents are important people to engage in this, in supporting the child.
Yeah, so ini is also the role of teachers at school. So kita dalam grup ini punya cikgu-cikgu kan, guru-guru yang dari sekolah tadika, ya. So all this guru-guru, cikgu-cikgu is very important that you understand anak itu di mana kesukarannya, kesulitannya, dan cara untuk membantu anak. Dan harus diberi strategi. Strategi itu bukan hanya dipakai di sekolah, bukan untuk guru saja yang tahu, harus diajarin kepada ibu bapaknya, penjaganya, supaya strategi itu digunakan secara menyeluruh di dalam kehidupan anak. So, bukan belajar di rumah, bukan belajar di sekolah saja, bahkan dengan strategi yang diajar kepada ibu bapa boleh digunakan di rumah juga. So, strategi yang kita gunakan bukan satu strategi saja. Maksudnya strategi itu lain anak ya harus menggunakan strategi yang berbeda. Kan anaknya semua beda-beda ya. So, harus strategi yang kita gunakan harus beda-beda. Jangan digunakan, oh anak A boleh gunakan strategi ini, so anak B juga harus gunakan strategi yang sama. Nggak boleh begitu. Gurunya yang di sekolah harus fleksibel gitu untuk mencari jalan yang lebih persis, yang lebih spesifik untuk anaknya, yang mana lebih bagus gitu. Yeah, that's what we meant by intervention.
Iya, Kak.
So tips to try. So if possible, if the school has learning support provided, talk to the school, let the child have, or consider for the child, if the child is appropriate to have special education needs support, because this is learning you're learning every day in school, so they might find it overwhelming and they might find it hard to keep up, but there are ways to help along the way. Encourage the child, acknowledge that it's hard, but we want to continue telling them to keep going. Oh, it's hard, but I can see that you did this one well. Let's keep doing it. Okay? We teruskan. Parent training, as said before, very nicely by Mila, parents must be involved juga. They are the ones that live with the child. They are the ones that spend most of the time with the child, if not in school, if they're not, or if the parents aren't working. Okay? Because the children growing up, they're always learning. Even us right now, we're always learning. So do not miss that opportunity lah. Because it's not just you bring it, it's not like work. You do work in the office and then you go home, you leave the work behind. It's not the same with kids. Yeah. And then self-advocacy. So we keep building the child's confidence, we keep letting the child try many things. So this is also on the social aspect as well. We don't want the child to feel discouraged or feel like they cannot do anything else because of their difficulties.
Ini maksudnya supaya anak mandiri ya. Ya. So,
Stand for
kita harus
themselves.
ajar anak untuk mandiri. Jangan dependent on kita saja, ya. Kalau kita ada ya oke, kita kan masih boleh bantu. Tapi ya kun fayakun hayat kita tidak tahu bila perginya kita, bila perginya anak. Harus kita ajar anaknya untuk mandiri.
Very
Ya.
nice. Okay, I believe that is everything from me. Any questions? That was a lot, but I will share the slides with you.
Oke, mungkin ada yang mau ditanyakan, silakan. Bisa dalam bahasa Indonesia, Kak Mila paham. Mungkin sambil menunggu Kak Mila, saya juga mau ada pertanyaan. Ini berhubungan dengan anak-anak hearing loss. Jadi kalau anak hearing loss dari lahir tidak mendengar, otomatis kan sepertinya ada masalah di bagian pendengaran dan larinya ke literasi gitu ya. Nah, apakah ketika belum mendapatkan teknologi yang tepat, itu dia sudah masuk kategori learning disorder atau kita baru bisa memastikan kalau setelah dipakein alat, mendengarnya bagus, terus dilatih tapi tetap ada kesulitan. Karena ternyata dari cerita orang tua, ketika sudah mendengar bagus, untuk membuat memorinya itu bisa nangkep seperti tadi poin-poin dari literasi itu juga tantangan. Nah, saya sebagai praktisi EVT lebih merasa karena mungkin itu keterlambatan intervensi dari sisi mendengar, bukan dari disordernya. Apakah itu bisa dianggap seperti itu, Kak Mila?
Yes, you are
Oh.
right. You ask the question and you answer the question. So
Oke.
it's penting, amat penting untuk orang yang berjumpa dengan anak. It's very clear dari segi pemikiran. Okay? So kalau anak itu mempunyai kesukaran dari segi pendengaran, so masalahnya ialah deria pendengaran yang menghalang anak itu daripada belajar. Kita harus faham anak belajar dari mulanya lahir. So bila anak yang ada masalah pendengaran tidak mempunyai akses pendengaran, derianya kurang, so dia akan mula belajar dan memahami benda-benda lain di sekelilingnya di saat alat itu dipakaikan. So kalau sudah 5 tahun tidak menggunakan alat pendengaran, jadinya proses pembelajaran sebelum 5 tahun ada, not mustahil, tapi dari segi visual, ya.
Yes.
Tapi benda-benda yang lain dari segi bahasa akan sulit untuk anak yang ada punya masalah pendengaran. Jadi akan menyukarkan dari segi semua jenis pembelajaran. Tapi tidak bermaksud anak itu mempunyai learning difficulty. So it's more of hearing impairment rather than anything else.
Oke, terima kasih Kamila. Mungkin menyambung juga dari pengalaman, ada kemungkinankah anak hearing loss juga otomatis akhirnya terdiagnosa mengalami learning disorder seperti kayak tadi kan ada istilah ADHD gitu kan, atau mungkin disorder yang lain tuh, adakah Kak kasus seperti itu gitu?
Yes.
Yang
Dayana, you wanna try?
I can't recall. Ada hal ya? You give it a shot.
Oh, yes. So, anak yang mempunyai masalah pendengaran juga bisa mempunyai masalah-masalah yang lain, sepertinya autisma, learning difficulty, ya bisa. Cuma kita harus berhati-hati. Orang yang menjumpai anak itu harus teliti, harus berhati-hati. Because kadang-kadang yang lebih cocok kalau kita tengok dari segi presentation of anak, apa yang anak itu tunjukkan kepada kita, lebih persis, lebih fokus kepada masalah pendengaran daripada yang lain-lain. So kalau
betul.
kita berfikiran anak itu mungkin ada masalah yang lain, harus nomor 1, masalah pendengaran beres.
Dibenerin dulu,
Benerin.
diberesin.
Ya, kalau itu sudah beres, dengarnya bagus, aksesnya bagus, datangnya bagus, belajarnya bagus, tapi masih punya masalah, then we can try and see and focus on something else and find out. Sometimes, kan hearing loss ini, kadang-kadang it can be sensory neural, but it can also be central processing disorder. So if they have
Yes.
APD, central auditory processing disorder, that is another type of learning difficulty. So the processing. So it's a processing disorder. Yes, it can happen.
Oke, terima kasih Kak Mila. Oke, mungkin ada yang mau bertanya, menarik ini bahasannya karena ini sesuatu yang sering kita jumpai juga di anak-anak, terutama dari guru-guru juga, mungkin dari pengalaman murid-muridnya, silakan. Teman-teman dari Smart Aurika, Batam, Palembang, atau Medan?
Yeah, Smart Orika Batam is very near to Brunei. You're in Singapore. Yeah, so hello friend.
Terbang ke Spark ya.
The nearest to us.
Ya, berarti kemarin pas aku di Batam udah bisa ya Kak langsung ke.
Kalau pakai aeroplane like about 2.5 hours bisa.
Oh,
Tapi kalau pergi ke Jakarta, kalau ke where are you again? Sumatera. No, where are you again?
Sumatera, Batam.
No, where are you? Anita?
Oh, Surabaya.
Surabaya. If Surabaya, I think it's like 3 hours, almost 4 hours
Direct or ini transit?
direct.
Oh, direct ya, Jakarta.
Jakarta 3 hours plus also, quite far.
Oke, kamu. Oke, masih ada waktu. Ada yang mau ditanyakan? Silakan, nggak usah sungkan. Tidak ada pertanyaan nggak bagus atau pertanyaan yang ini. Kita sama-sama belajar.
So,
Atau dari praktek pengalaman, silakan teman-teman. Mumpung
Kak
ini
Mila.
dari Kak Mila dan Dayana mau
Ervina mau say something? Carry on, Ervina.
silakan Kak Evina.
Halo Kak Mila, halo Kak Dayana. Saya punya pasien untuk masalah dengarnya itu sudah clear dan bahasanya sudah bagus. Namun saat terapi wicara bersama speech therapy itu dinyatakan mengarah untuk ke disleksia seperti itu. Kalau dari saya sendiri melihat itu tidak terlihat ya Kak. Jadi karena harus betul-betul teliti, harus betul-betul cermat untuk melihat anak itu mengarah ke disleksia. Nah, solusinya bagaimana Kak Mila? Karena untuk orang tua itu bingung gitu. Ini apakah benar anaknya disleksia atau tidak? Seperti itu Kak Mila.
So, Diana, you want to give it a try?
Boleh kalau one of the things boleh coba is tanya the child if dia rasa pening membaca. Because itu one of the ciri-ciri yang seorang individu ada disleksia. Pasal bagi mereka the patah perkataan itu semua bergerak atau pusing atau macam-macam lah. So you boleh tanya. That's a simple one pulang because dia yang mengalami disleksia, dia yang lebih tahu kondisi itu.
Bisa, Ervina?
Oke. Begini Kak Dayana, kalau anaknya masih umur 4 tahun belum bisa membaca dan
Oh ya,
Ah,
Amin.
4 tahun. Aduh.
Atau
Nah.
keep monitoring kali.
So basically what you want is you want to tell the parents, bilang sama ibu bapaknya, aduh Bu, anaknya masih muda, 4 tahun. Bu, di sekolah belum lagi belajar, kita usahakan dulu ya.
Terus
Kita
kalau
belajar dulu huruf-hurufnya, kita belajar dulu kenal bunyi-bunyinya, kita kenal dulu nyambung-nyambung gitu. Baru nanti kita usahakan lagi, pikirkan lagi mengenai disleksia. Umur 4 tahun ya Allah, muda. Begitu.
ya.
So, I would personally tell that to the parents, and also I would work on phonology, because then you can work on literacy. Kak Ervina bisa nggak menggunakan, kan Indonesia sekarang, bukan sekarang ya, dari dulu juga ya, sudah pakai fonik kan, ya, A, B, C, D,
Yes.
Ya.
so itu kan sudah fonik. So fonik itu nanti diajarin untuk menyebut suku kata ba, 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 be, gitu kan?
Ya.
Yeah, okay. So you work on that. So that's already phonics. So you work on that, getting the child to recognize letters. Just do that first. I wouldn't worry about the diagnosis because it's still too young to
Yeah, right.
Oke, oke.
Oh yes, oh.
Kamila, thank you Kak Dayana.
Thank you.
Terima kasih Kak Vina. Ada lagi yang mau bertanya? Silahkan. Oke, kalau belum, saya juga mau ada pertanyaan lagi nih Kak Mila ya, sama Kak Dayana. Jadi ini balik lagi anak-anak hearing loss, tapi dia sudah mendengar bagus, udah berusia masuk sekolah, artinya udah 8 tahun ke atas. Tapi ada beberapa kasus, kebanyakan anak itu bisa menulis tapi hanya mengcopy. Dia tidak memahami makna apa yang dia tulis. Nah, pertanyaannya ini adalah apakah masalahnya ke masalah program belajar yang tidak sesuai dengan kebutuhan atau mungkin memang ada kemungkinan mengarah ke kesulitan membaca atau memahami apa yang dibaca. Karena ada beberapa dan salah satunya ada yang udah gede juga, udah 17 tahun, 18 tahun dan sudah sekolah di sekolah khusus juga sebenarnya gitu.
Dayana, that's a good one. Are you stumped?
I'm stumped, surprisingly.
Okay. So, begini ya, kalau anaknya sudah besar, sudah sekolah, kan kalau masuk sekolah baru tahun 1, kadang-kadang masih sulit ya bagi banyak anak untuk belajar membaca. So, harusnya kita beri anaknya masa untuk belajar dulu. Jangan terus-terus, oh ada kesulitan gini. So, harus diusahakan dulu, diajarin, diusahakan. Tapi kalau sudah ya 1 tahun lebih, masih ada kesukaran untuk memproses visual yang ditulis dengan apa yang difahami. Salah satu strategi that we can use is menggunakan visual. Kita pakaikan visual. So kalau nampak tulisnya kucing, gambarnya kucing, matching kucing dengan the words, so then they can match the words. So that's one way of doing it. But you are not wrong. There is a possibility. Kita sudah bincangkan tadi, ada besar kemungkinan anak yang punya masalah pendengaran juga mempunyai masalah proses-proses yang lain, ya. So, bagi anak yang sudah gede-gede, yang sudah 17, sudah 18, that is a clear sign that they are having problems learning. So are having problems transferring the visual word to the meaning. So that is part of learning difficulty, just not specific dyslexia, just not specific dysgraphia, but that is a sign that they are struggling with the academic and that is learning difficulty because sudah besar ya, berapa belasan tahun sudah sekolah. So then that is clear. But for anak muda yang baru masuk sekolah, saya sarankan kita usahakan dulu, sabar dahulu, jangan mudah untuk diagnose anaknya ada masalah. Because once kita bilang sama ibu bapanya, ibu bapa tidak akan lupa. Selama-lamanya akan ingat Anita yang bilang anak aku disleksia. Tapi sudah tidak, ya.
Jangan.
Tidak cekap. So jangan mudah untuk terus
Vonis ya Kak ya.
So you have to be very teliti because all in all, it tidak mudah gitu. Ya, one, learning difficulty is already not easy. Apalagi learning difficulty paired with hearing impairment, it's not easy. It makes it more complicated. So take your time, ask people, ask the right people. Ya, Ervina, yang itu speech therapistnya, put it on the radar. Ya.
Oke, Kak Mila.
Find the right people that can help you. Yeah. Psychologists are good. Get the chartered one, the clinical psychologists, they are good. They should be our best friend.
Ya. Oke, mungkin udah kita masih ada waktu Kak Mila atau
Ada?
sudah cukup?
Oh, we still have time if you want.
Oke. Ada lagi teman-teman yang mau ditanyakan karena sebenarnya ini sesuatu yang pasti sering kita alami gitu ya. Eh, silakan, nggak usah sungkan kalau ingin bertanya.
Kalau tidak ada yang tanya, mungkin Dayana want to share a case that we have in Sparkle that has
Oke, bisa Kak, silakan.
in the spot, but do you?
I can share a bit, but you can fill in lah because it's your patient. I'm thinking of a patient that is being seen by Mila. Dia umurnya 18 tahun sudah, 19 kah? Dia dengan Sparkle sudah 1 tahun. So dia datang, ada ciri-ciri learning disability lah. And dia sendiri pun tahu dia orang yang
Istimewa.
special needs,
Hmm.
orang istimewa. And then so dia come to Sparkle to work on social skills and then learning as well sikit-sikit, but it's different because it could follow his interest lah. He learns best if it is his interest. So we start off with his interest and then we do something that he doesn't necessarily like. Does that make sense? Is there a specific example you want to share, Mila?
So, anak ini bisa mengeja, bisa menulis, dia bisa menulis namanya. Okay? Tapi kalau kita suruh tulis namanya yang panjang, kadang-kadang di tengah-tengah menulis hurufnya besar. Ya, mengapa besar hurufnya? And then dia mudah ketawa, aduh, pusing, and then he will erase and then he will try to make it smaller. Okay, so because that's practice. So mixing letters is a sign of difficulty processing, which one we have to use, number 1. Number 2, he cannot spell and he cannot read. He can read high frequency words. So high frequency words kita sudah bilang last month. High frequency words adalah perkataan-perkataan yang sering kita lihat, yang sering kita gunakan untuk
Common ya Kak, common word like that.
correct. So not just common, but it appears a lot of the time. So kalau mengikut anak ini yang sukanya is football, so yang common would be things like Manchester, Ronaldo,
Oh ya.
brand Adidas. These are things that he's very familiar with, yang dia suka, yang mudah dan sering-sering keluar. Okay, so he can read all this. Tapi kalau saya introduce a new word, so for example, goal post, itu yang tempat jaringan, ya, tempat
Oh ya.
goal post. He doesn't understand because it doesn't come. Walaupun topiknya sama, minatnya sama, tapi it's not a common word. Finds it difficult. So that's a learning difficulty. Yeah.
Wow.
Yeah.
It's a pleasure. I love him. I love him to bits.
Yeah, it's for me it's like new story because me is like focus for the language. My question is for the school is normal school or special school Kak, for this kid?
He used to attend normal school. Habis sudah apa namanya ni mandatory schooling finish. So now mom puts him into a special school and also attend Sparkle. You know what? I have a picture of his drawing. I can on Sparkle IG. I can always find the link and then I can put it in the group. And then
Yes Kak.
so
Yes can Kak.
it's special like that. Yeah.
Yes yes.
He is a fun
Wow.
boy. He's eager to interact and socialize. Kanya, it's the processing of, you see someone, you greet them, and then you make small talk. But for this boy, he just says, he looks and he waits for you to say something first, or something like that. So we teach him to say, you see a friend, you bagi salam, you say, Assalamualaikum, you put your hand up like this. So it's things like that. And he's a pro at it now.
Karena anak ini sudah 18 tahun, tapi pemikirannya kan masih muda. So, I would say dalam umur 7-8 tahun gitu pemikirannya. So, sekarang dia start bilang sama kita yang dia punya pacar. Ya, so
Yeah.
akan bangun, akan grow, they will grow, okay? So now the problem is I am trying to say, ya bisa ada pacar, tapi apa yang harus kamu buat? Apa yang tidak harus kamu buat? Ya kalau
Apa yang
saya,
boleh dan tidak boleh ya Kak?
ya, apa yang halal dan tidak halal,
Ya.
ya. So harus diajari.
eh,
So, saya bilang sama anaknya, oh, kalau duduk sama pacarnya, dekatnya seperti mana? Dekatnya gini atau boleh pegang-pegang gitu. So, these are social skills that we have to teach. Kita ajar. Because kalau ikut pemikirannya, pacar itu kan seperti ibunya, seperti kakaknya. So, kalau dia bisa peluk ibunya, kenapa tidak peluk temannya? Because they cannot separate. So you have to teach. Your mom is your family. Family you can do. But someone else is not your family. This is bukan mahram. This is haram. So kita harus ajar. Ya bisa. You can still hug. Tapi hug gini, hug gini. You can say all different ways of greeting. So far very, very good. Very, the way he learns, it takes time, but very, very good. Yeah, but
Jadi, so Kak Mila not just teach about the language, but teach about like the attitude, about the psychological. Dan maybe I'm remember one of our case, Kak Ervina, you remember one of our case, the age and the maturity is different. Kinan, Kak Ervina?
Oh iya, Mbak. Mm-mm.
Mungkin kita bisa coba tuh terapkan yang disampaikan Kak Mila untuk pendekatannya, karena kadang kita itu hanya terlalu fokus ke ngecek pendengaran, ngecek bagaimana berbahasa, berkomunikasi, dan ketika kita melihat kematangan si anak ini di bawah usia, kita tuh kadang bingung Kak Mila, mau diapain gitu ya anak ini. Jadi hal seperti ini sepertinya memberi insight nih buat kita Kak.
because if you work
Terima
on
kasih.
skills, you are also working on language, you're also working on hearing, you're also working on vocabulary, you're working on all those things. Tapi ini kehidupan seharian. Bagaimana
Betul banget.
masyarakat. These are important skills. Ya.
Ya, betul. Atau mungkin satu lagi Kak Vina yang siapa yang dari Pati ya? Dari itu bisa dicoba ya Kak pendekatannya Kak Vina.
Oke, Mbak Anita. Yang
Ya, you make us new insight. Thank you Kak Mila because the maturity is sometimes like problem too.
True.
Jadi usia, kematangan anak, bahasa, komunikasi itu kadang mix seperti itu.
Ya kompleks ya.
Yap, betul banget.
Right.
Ya, mungkin thank you so much for the case sharing, and maybe for the next we can plan same like that if we have time to preparation like teman-teman di Smart Aurika atau rekan-rekan terapis independen atau praktisi EVT yang ada di Nobel atau di hearing center yang lain, nanti kita bisa sharing kasus. Misalkan ini kan Kak Dayana sudah mempresentasikan step pertama ya, learning difficulty introduction. Jadi ya kalau misalkan nanti kita ada kasus-kasus dulu yang mau dibahas, bisa saja ya Kak Mila ya.
So
Biar lebih
I was
masuk gitu ya.
I was thinking the next one would be kasus-kasus, sharing kasus-kasus daripada Indonesia dan
Betul. Terutama mungkin di teman-teman guru, karena kan muridnya pastinya lebih beragam juga gitu ya. Tidak hanya pendengaran, bisa delay speech, bisa spesial yang lain, nanti bisa ibaratnya kalau nggak enak bilang di grup, bisa juga disampaikan ke Bu Sari selaku penanggung jawab Smart Aurika. Jadi itu bisa untuk bahan diskusi di next, termasuk untuk tim saya di Nobel atau teman-teman di luar seperti ada Kak Ellen atau tadi ini ada Mbak Dini. Mbak Dini ini juga dari UPTD itu seperti punyanya pemerintah Kak Mila yang fokus di bagian anak spesial di Surabaya. Jadi silahkan kalau nanti ada yang mau didiskusikan kasusnya next pertemuan. Halo Mbak Dini, mungkin bisa nyapa, ini baru bergabung, bisa menyapa Kak Mila juga.
Hello, I'm
Halo.
Halo.
Indonesia this one dari pemerintah. Well done.
Ya, saya dari Unit Layanan Disabilitas Sidoarjo.
Wow.
Kita juga menangani semua anak disabilitas, mulai dari asesmen sampai habilitasi, sampai ke pelayanan ke sekolah-sekolah juga.
So asli itu umurnya
It's free,
berapa?
Kak.
It's free.
It's free.
Wow.
Ya, ya.
I used to do free. I don't do free anymore. But free is not easy. Free is a
Yes.
lot of work because semua will go to free. Yeah. So you see
Yep.
a lot of kids. It's hard work. I understand. But well done. Well done, Indonesian government for having. I don't
Selamat datang Mbak Dini.
Oh.
Nanti kalau ada yang mau dibagikan kasusnya bisa direncanakan next gitu.
I'm more than happy.
Ya,
Yeah.
sebenarnya kita ada kabar juga bahwa di semua kabupaten di Indonesia itu sudah mulai ada undang-undang di mana semua tempatnya harus punya unit layanan disabilitas yang tidak berbayar juga.
Wow.
Berita terbaru seperti itu.
Dikabari aja Mbak yang sudah jalan seperti Sidoarjo ya. Karena
Ya.
kebetulan tim kita juga nyebar se-Indonesia. Siapa tahu bisa untuk memang yang benar-benar. Ini kan ada kayak syarat ketentuan yang tidak mampu kayak gitu ya Mbak? Atau ada
semua.
syarat-syaratnya?
Tidak ada, semuanya bisa. Semuanya bisa dilayani.
Wow.
I have a question. So, Mbak Dini, kalau maunya masuk ke unit ini ya, harus what's your background? How do you get into it? What's your academic achievement?
Oh, kalau kita tenaganya itu dari berbagai tim ahli sih. Kita punya psikologi, ada psikologi klinis ada 3.
Oh, not bad.
Kemudian speech terapis punya 2.
Not bad.
Ya, terus ada terapis okupasi 2.
Wow, OT.
Ada fisioterapis 2.
OT
Nah,
too.
habis itu terapis perilaku sekitar 20-30 orang.
Of course. Yeah.
Ya.
Oh my God, that's amazing. You have a team. Okay.
Yeay.
Are you like school-based or like clinic-based or community-based or seperti mana ya?
Kita lebih ke asesmen dulu. Kita kalau ada apa tuh namanya masyarakat yang ingin dites dulu, di asesmen dulu. Kemudian nanti kalau memang dia berkebutuhan khusus tertentu akan kita berikan terapi sesuai dengan
Kebutuhan.
kebutuhannya gitu.
So this is more community then, bukan di hospital ya? Bukan di hospital, bukan di klinik, more community. Well done, well done. I'm very happy.
Kapan-kapan boleh kita saling main ke sini boleh.
Oh my gosh, so expensive, but yes.
Aku wakilin aja ya Mbak Dini ya. Kak Mila nanti Zoom gitu ya.
Can. Oh my God, Saida wants to go. Well, Saida is planning.
Yeah. Saidah come to Surabaya and I will bring you to Sidoarjo.
Ya.
Oh,
Okay, I will consider someday.
Tell me ya. Tell me the date you come and I will prepare.
Can.
Well, I'm genuinely very happy because ya saya dulu hari itu ke Indonesia kan lebih daripada 10 tahun yang dulu ya.
Yeah, 10 years ago.
Yeah, 10 years ago. 10 years, actually, yeah, 10 years ago, yes. 10 years ago, there's no such thing as free from the kerajaan, the pemerintah to the people of Indonesia, right?
Yeah,
When you were saying,
yeah.
why didn't that happen? Indonesia is a rich country. Indonesia can do it. They have the resources. They have the people. They just need to put things together. I am very happy Indonesia is doing something for their people because your people are important. That's how you grow. Right?
Yep, yep. So happy Kak Mila.
Ya.
And hope many place same with that in maybe another city ya Mbak Dini ya, tidak hanya di Sidoarjo.
Yeah, amazing. Well done. It has to start somewhere. It has to start small, but you sound like you already have a good team that it can just grow, kan? Oh, that's so cool.
Yeay.
Oh my God, amazing. I see you soon again. So,
Ya, oke.
jangan tidak.
Oke, terima kasih. Alhamdulillah, sesi kita ini udah masuk ke pertemuan yang kelima dan luar biasa. Istilahnya teman-teman juga dari sesi pertama sampai kelima selalu bersama belajar. Ketika dikasih kuis-kuis juga aktif menjawab dan pastinya saya juga terima kasih banget ke Kak Mila, Kak Dayana dan eh, Kak Saidah. Nanti next kita diskusi lagi dengan plan-plan lanjutan. Insya Allah ilmu yang diberikan akan barokah, berkah, dan kita bisa sharingkan juga ke
Yang lain lagi.
anak-anak yang membutuhkan.
Insya
Okay, maybe the last want to take a picture, Kak, for the documentation.
Allah. Gambar.
Yes.
Please on cam if you want to memorize this month. And we will meet again next month. Oke, mungkin dari Kak Dayana bisa yang mengambil gambar atau?
Boleh.
Yeah, I can do it.
Saya belum
you.
share last time juga, but I will share.
Yes, I waiting.
My gosh, orang tadi Batam, tapi connectionnya is only one. Because I was looking at Palembang. Palembang is like 3, 4, and then with a child. Yeah, Batam has a lot.
Yeah.
Ooh, well done.
Yes.
Come close to
Tunggu.
Palembang. Come close to this.
Mendekat Kak Ibu Guru Palembang biar lebih kelihatan.
Ibu guru, bukan cikgu.
Nanti dikirim ke Bu Sari, wah, sebagai absen.
Buka kamera.
Yes,
Kak
hello.
Rizky, Kak Mia, Kak
Oh,
Sherry.
Palembang ada 2 ya. Well done. Oh, Palembang ada 3.
Ada banyak tuh Palembang.
Banyak.
Well done, Palembang. Palembang is Melayu. Melayu Nusantara with us. Yeah.
Yes.
Oke.
Oke.
Ready ya? Semua sedia? Ready? Wing senyum dulu. 1, 2, 3. Oke, freestyle. Oh.
Oh.
Oke.
Oke.
Alhamdulillah. Thank you all for coming.
Terima kasih. Terima kasih meramaikan Nusantara Sharing. Sampai ketemu lagi. Sehat semua.
Insyaallah. Thank you Kak Nita for hosting as
Ya,
always.
thank you so
Good
much for
MC.
your materi. Very helpful and insight. Thank you Kak Mila, Kak Saida,
Bye,
dan
everybody.
teman-teman semua.
Thank
Bye.
you. Bye bye.
Saya tutup. Assalamualaikum.
Waalaikumsalam.